need someone like myself who's going to guide you. I've been doing this for 25 years. I know the ins and outs. I know the road bumps that you're going to face and how to overcome them because I overcame them, right? So to answer your question, yes, absolutely, it's a business. But at the same time, you can't say it's a business, so I'm going to do what I want, right? You still have to listen, but you have to use your gift of discernment. You have to listen and run it through your wisdom that you know and what you've learned because you've been advocating for yourself. You've been studying, you've been learning, you've been coming on Poetic RN, you've been following Dialysis Disciples, and you're starting to get a knowledge base. So if the doctor tells you something, you can run it through that knowledge base and be like, wait, but someone I know who's walking this journey, he or she said such. And then make that doctor give you an explanation. Again, it's very important to realize that they work for you, Poetic.
Right. I totally agree with that. And I think often people leave a doctor's appointment, have no clue what they said, what they talked about. I always encourage people to write your questions down before the appointment. Yes, boss man, it's fine. To write your questions down before your appointment. Make sure every question on there is answered. If the questions are not answered, then make sure that you, tell the doctor, come back in the office. You pay for that visit. You pay for that time. But so many times the nurse comes in and the doctor's in there for 5 minutes. The patient doesn't even know what has happened. They're started on new medications. They don't know why. They don't know the side effects. They don't know anything about the new medication. So y'all know I get short of breath.
You got this,
commercial break. You need a commercial break?
Yeah, I'm having a flare up. I'm having a lupus flare up, y'all. So it's affecting my lungs.
Do a commercial break right quick, bro.
Okay. Go ahead, boss man. And then I will go down to T-Mac, Max, Gigi, Tyra, and Poet. Okay. Boss man.
No problem. Welcome in, everybody. Y'all keep tapping that screen. Y'all know what's going on. It's discussion on dialysis, and we got a guest up here sharing their experiences. We're gonna have other people that share their experiences as well. And then whenever she opened the panel up for questions, y'all make sure, like I already said, have your thoughts in order, and we're gonna get through this in a timely manner because right now, she has a lot on her, and we're gonna keep it going smoothly. Y'all keep tapping that screen. Make sure you follow her bio. Go to her bio. This will be on YouTube. Follow her on YouTube, and make sure you miss anything, you can go back and rewatch anything, get any kind of knowledge that you may need to help you out with your wellness. Okay. Make sure you set out her goals. She got a goal up there. She do a lot for us every week, every Saturday morning at 9 o'clock. Y'all make sure you set that goal out, and you see Poetic RN, make sure you show some love in the CA. Go ahead and show some love, and do not bombard her with your emails, okay? She got already a lot on her plate. Don't be aggravating her with your long-winded email like y'all be long-winded on this app. We ain't got time for none of that, okay? None of that. So y'all keep on tap away, get your snacks. Go in there and get your sandwiches and everything. Get your bowl of grits. We're gonna get into this thing right now. And one other thing too, before I give it back to Darling here, go get your fans for your iPhone because I know they're gonna get hot. We got still the rest of the show to go. Go ahead, Darling.
I'm gonna mute him. Thank you. So I'm sorry. I had to get my inhaler. Y'all know I'm having a lupus flare up. So. T-Mac, morning T-Mac. So T-Mac, can we hear your story, please?
Yes, good morning, everybody. Good morning, my Poetic.
T-Mac, my baby.
I've been diabetic since I was 7. When I moved to the South, I fell and broke my leg in 3 places. 5 years later, I got osteomyelitis in eggs. During that time, my kidneys were already showing signs, but my nephrologist which is a kidney doctor, was keeping my kidneys okay. Like Poetic said, like Dialysis said, eating right. So I was keeping my kidneys stable because I was doing what I was supposed to do. Unfortunately, when I got osteomyelitis, I had stopped eating, and it just went downhill from there. I ended up going to the emergency room because I could not breathe. And I woke up in ICU finding out that I was on dialysis at that point. So I've been on dialysis since 2012, so about 13 years. I am one of those that whose veins have calcified, so I do not qualify for a transplant. I saw Tyra with the Y down there say that that's calcification is normal. I don't know how she put it in dialysis patients, which I am now finding, but they don't tell you that. They don't, when they tell you about the eating right, I think it has to do with phosphorus and all of that.
Yes.
And telling you that if you don't keep your phosphorus at a normal level, that your bone, you won't have healthy bones. But they never tell you about the calcification and how that could stop you from qualifying for a transplant. So that's where I am now.
I'm so happy.
Say though, I have another friend. I have another friend who's been on dialysis. Can you hear me?
Yes.
Can you hear me? Okay. I have a friend that's in the same dialysis clinic as me. She's been on dialysis for about 20 years. She's going through the same thing I'm going through. And she did some research because I brought it up to her. I said, I'm not stopping here. With all the research that they do, somebody has got to be looking at this. So she did some research and found, I forgot the name of it, but there's some kind, they're doing something where they can go into the vein, the calcified vein, and I think it's particularly for the heart, the vein connected to the heart, and kind of start breaking up the calcification. So I'm looking into that right now to see if we can go further. So I do have, I'm like you, dialysis. I had grafts. They put those grafts in me that you can use the next day. Never telling me that those kind of grafts conk out quickly. So I've had those grafts. I now have no veins in my arms that can be used. They tried to go in my legs because doctors hate for you to have catheters, heart catheters. So they've tried to go in my legs, but because of my diabetes, because of the osteomyelitis, I was like, no. And like you said, dialysis, you have to be your own advocate because regardless, they still trying to go in my legs. And every time I have to tell them, no, my vascular surgeon said it's okay for me to have this heart catheter because if you get an infection in your heart, you can get an infection in your legs like you can your heart. We just have to watch it closely. So that's what we're doing with me. I do have a heart catheter, and we're just watching it closely to make sure.
Thank you, Shumbu. So how long have you been on dialysis this time? And I'll come back to you, dialysis, Troy. I'm sorry.
So since 2012. So what, about 13 years?
Okay. Thank you, T-Mac. Don't go anywhere. Dialysis, go ahead. And then I want to jump to Tyra for a second and ask Tyra a question. Go ahead.
No, I'm sorry. I think you misinterpreted I'm a very boisterous person.
Oh, that's right.
When she was saying that this was me saying, God bless.
Oh, okay. I got you. I'm sorry. So before I go to Max, Tyra with the Y, I always talk about this soda pop. Soda pop sucks the phosphorus out of your bones and breaks the bones down. So go ahead and tell me what you were going to say about the phosphorus and stuff.
Good morning, Poetic. Thanks for having me. So yes, I did work in dialysis for many, many years, like over 20 until I switched careers, I guess you could say. As a dialysis tech, one of my things was to try to advocate and let the patients know, right, like the effects that different things have on them. So phosphorus is like one of those silent things, right? And it's contained in most of the food that we eat, right? So it's a very important thing to for the patients to try to, monitor their intake and take their binders and things like that, but they are very upsetting to their stomach. So I think that a lot of times it's like this thing, like where the doctors say, hey, well, you need to take 2 of these pills. You need to make sure that, they're big pills, they're horse pills. You need to take 2 of these, and then the patient may stop taking them, right? And they don't take as many as they're supposed to be taking. It just turns into a revolving door. So then when they see that their phosphorus is going up, right, they just add on 2 more pills instead of getting to, because there are many, many different types of binders, right? Mm-hmm. Instead of trying to find the one that may work for that particular patient. Mm-hmm. Another thing that I kind of wanted to touch on was modalities. Like there are 3 or 4 different modalities for end-stage renal disease patients, right? Like you have in-center, which a lot of times that's where people land or they end up, but you have peritoneal dialysis, which if my kidneys were to ever fail, that would be my number 1 choice. That's through the stomach and you do it at home. But a lot of people, what they don't realize is you may not qualify for it because you don't have people in the home with you, or because you've had a type of abdominal surgery. Like in my case, I had 2 C-sections. Once that peritoneum is breached, if you can say, right, then you may not qualify because that membrane isn't as strong. But the best modality is to get a kidney transplant, right? And I feel like that's a lot of times where patients are failed is because they aren't given that option. They come in so sick, and they come in, a lot of times it's something that just kind of, they don't know. They're not having a nephrologist to follow them. And so they're like thrown in center. That's one of the things that I noticed. But I think that the most important thing is if you can get worked up for a transplant, like if you're stage 3 or 4, get worked up for a transplant, like right then. If you have the pleasure or the advantage to know is to try to get a transplant. But in-center dialysis, of course, you do have the 3 different types of ways to be dialyzed. You have your catheter, which is the least desirable, right? Because it is a catheter that is sitting in either like your superior vena cava, or you have a tunneled one, which it's going directly to your heart, and there are a lot of chances for infection. And then the graft, of course, that's Gore-Tex, and then a fistula, which is your own artery and vein. I don't want to take up too much time, but
no, you're fine. Why do you think it affects more of our population? I mean, it affects every population, every culture, but why so much more us?
I think diabetes and hypertension, right? And those are things that are common among us, right? Like, so, you think about the foods that we eat and things like that, and, having an aversion to doctors and it's uncontrolled hypertension, which that's something that's very controllable, right? It can be. Right. And uncontrolled diabetes, not getting on the medications and doing things. When I started in dialysis, when I was 18 working in a dialysis center, right? Those patients were so much more sick. It has changed now, right? Like I have seen a flip, but there's so much more. They were very sick people, right? Like just working in that population then. I think that now people are starting to go to the doctor more, and, you don't see it necessarily. You see it, right? Like you have your older population and things like that, but they're not like as sick. Like they were sick people back in 2002.
Right.
They were very sick.
You're right, because I think it was maybe 2000 when I did work dialysis, and they were so much older. Now it's a lot of young people are affected, and people that are still working and doing dialysis, whereas back then, you're talking like 70, 80, people were on dialysis. It was very rare to see a person under 30 on dialysis back then. So much has changed, though, I know, but did you notice that too?
Yes, they were a lot older, where, you may have like your outliers, right? Like when you have people with polycystic kidney disease and different, things that definitely like affect the kidneys in that way. But I think the youngest person that I've ever taken care of, he was a 17-year-old kid that had polycystic kidney disease. And I mean, you think about it, like someone that young that is having to be on dialysis, and they can't drink as much, and they can't, like do all of the things, right? So as you can imagine, that was a hard time. But they were a lot older. They were a lot sicker. I think that one of the things that we can all do is like just advocate for ourselves. I remember I had this one patient, she was an older lady, and she ended up starting on dialysis, and she did everything that she was supposed to do. And after 6 months, she said, Tyra, I want to talk to the social worker. I don't want to do this anymore. Like, and that was her choice, right? She was like, I don't like my quality of life. I don't like the way that this is going. And she lived for like a whole 2 years after that.
Wow.
A whole 2 years after that. So it also makes you feel like, are they starting them too early? Are they starting? It's a very tight rope when it comes to things like that, because sometimes you're not as sick. You have residual function. You may not need as much. But yeah, so it's not like a cookie cutter type thing. My grandmother, she was also on dialysis for at the end of her life, and she decided to stop. That was her decision. But she knew that she was in her 80s and she did not want to do it anymore. So it definitely, and that was towards the end of me working in dialysis. But yeah.
Thank you so much. That is very valuable information. I really appreciate that.
Thank you. It's my pleasure. Mm-hmm.
You mentioned PCKD and Max polycystic kidney disease. So Max, can you tell us your story?
Sure. Good morning, Poetic. Good morning, panel. Good morning, everyone. So I was born with a hereditary disease called polycystic kidney disease. And basically you're asymptomatic until you're not. And I was on dialysis for about a year. I had the choice between in-center or peritoneal dialysis. I in-center in-center because I just didn't trust myself enough to make sure that I did everything appropriately while I was home.
Yeah.
For those of you who don't know, once you reach end-stage renal disease, you're entitled to get Medicare, irrespective of what age you are, and the Medicare will cover the costs of dialysis and things of that nature. So after being on dialysis for a year, I was eligible for a transplant, and I received a transplant, a living donor transplant, from a childhood friend. That was perfect match, and that was about 17 years ago. Another important thing is to ensure that you remain on your what they call a kidney diet, and they give you a lot of information on what you can eat and can't eat. Things that have phosphorus or potassium are not really good for you, and you'd be surprised about the number of things that we consume every day that have those things in them. There are shortcuts and things that you can do, like if you like to eat potatoes, you can just soak them in water until the potassium, gets out of the potatoes. But that's something that you can't do often. You can't eat tomatoes, you can't eat chocolate, you can't eat nuts. So there's just a whole host of things that you cannot eat.
Right.
I think it also depends on what hospital or what doctors that you have. I was fortunate. I live in New York, so I was fortunate enough to have my transplant at New York Presbyterian Cornell. I had a great surgeon, great doctors there, and so that's the short version. I don't want to take up too much time.
Can you tell us the size of your kidneys when they removed them?
So those of you who don't know what polycystic kidney disease is, it's basically cysts start to develop on the kidneys. And the longer that you're asymptomatic, the longer that those cysts start to grow, and they engulf the kidneys, and the kidneys grow with the cysts. So when I did have the transplant, I had a bilateral nephrectomy, which means they took both kidneys out. Each kidney was about 15 pounds. So my stomach was extremely distended. My son was like, "Dad, you look like you're pregnant," and people at work were like, I was also very extremely fit. And so when my stomach started to grow, I started to get comments at work, and to avoid people, I work in a corporate office. So, people are very nosy and want to get in your business. I just used to say, well, I'm getting older and I'm drinking beer, which I didn't do, just to avoid those types of questions.
Mm-hmm.
Yeah.
Is your blood pressure and everything good? Do you have to?
So one of the systems of having PKD is you have hypertension. So I was in my 20s with hypertension, and they couldn't understand why somebody that was so young had hypertension, and that was before I was diagnosed with polycystic kidney disease, which happened as a fluke. I was getting tested for something else, and they saw cysts on my kidneys, and they referred me to a nephrologist, and then that's when I found out that I had the disease. Before I became symptomatic, I think from the time I found out to the time I became symptomatic was about 20 years, I guess, well, maybe 15 years. And you just start to get sick. You start to get tired. You're nauseous a lot. You're regurgitating a lot. You have pains in your abdomen or pains in the kidneys, because sometimes what happens with the cysts that are on your kidneys, they burst. And when that happens, you get a lot of pain.
Is there something that has to do with the brain and polycystic ovarian syndrome?
Yes. One of the tests that I had to have when I was in the hospital, because again, I was having excruciating pain in my abdomen. I didn't know what it was. And I was rushed to the hospital. And by the time I got there, I was unconscious. And when I woke up, they were doing dialysis through my neck at the time. And I'm sorry, what's the question again?
It has something to do with the brain.
So I had to, because the cysts weren't only on my kidneys, I had them in my arms, I had them in my legs. So they had to do an MRI scan of my brain to ensure that there were no cysts in my brains, and that came back negative.
Okay. Awesome. Thank you so much, Max. I appreciate it. And you can stay in case anybody has questions. If you guys have a private account, the mods control the panel. So if you could unprivate for a minute, that would be great. Gigi, good morning, Gigi. How are you?
Good morning, Poetic and everyone.
Gigi, you do peritoneal dialysis, right?
Yes, ma'am. So I do peritoneal 7 days a week, at least 10 hours a day.
And can you explain how that